No more epilepsy. Epilepsy is a very old disease. About 50 million people suffer from epilepsy worldwide. Epilepsy is the most common neurodegenerative disease after stroke. Definition of epilepsy. Brain diseases or lesions of different causes cause abnormal paroxysmal, excessive and disorderly discharge of brain cells, resulting in various clinical symptoms and paroxysmal changes in brain waves. The clinical symptoms are called seizures, and multiple seizures are called epilepsy. Causes of epileptic seizures. It may be genetic, symptomatic or unexplained. It can be simply divided into congenital and acquired causes. Congenital causes. Congenital or genetic abnormalities in brain metabolism or development. Acquired causes. 1. Structural lesions. Hypoxia of brain cells before and after birth, brain trauma, tumors, vascular abnormalities, stroke, hemorrhage, infection or degenerative diseases. 2. Metabolic lesions, such as too low or too high blood sugar, abnormal kidney function, electrolyte imbalance, drugs or alcohol. Common symptoms of epilepsy. 1. Tonic-clonic seizure, grand mal, sudden fall to the ground, sometimes with a loud scream, loss of consciousness, eyes hanging, clenched teeth, foaming at the mouth, stiffness and cramps of the limbs, often accompanied by incontinence and tongue biting. After the seizure, the patient presents drowsiness, confusion and amnesia. 2. Absence seizure, minor seizure, a transient state of absence, with a dull expression, eyes looking straight ahead or blinking repeatedly. Movement or speech stops temporarily during a seizure. Symptoms usually last from a few seconds to 30 seconds. After the seizure, the patient can continue the original movement or work without confusion. 3. Temporal lobe seizure, complex partial seizure. Typical seizures have precursors, impaired consciousness and combined automatism, mumbling, grabbing things with hands, repeated unbuttoning movements, making strange noises, walking around, running, riding a bicycle, headache, amnesia, drowsiness and general weakness after the seizure. Sometimes temporal lobe seizures can develop into secondary full-blown seizures. 4. Myoclonic seizures, short, irregular and electric shock-like twitching of the head, trunk or limb muscles. This irregular twitching often occurs when just falling asleep at night or just waking up in the morning and may be manifested in part or both sides of the body. Treatment of epileptic seizures. Keep calm and check if there are other people around who can help. Do not restrain, grab the patient or try to stop the twitching. Confirm the time of the seizure, tell the doctor when seeing a doctor. Clean the environment around the patient during the seizure to avoid injuries to the head and limbs. Untie the tie or collar to avoid difficulty breathing. Let the patient lie flat and support the head with something soft. Gently turn the head to the side to allow the contents of the mouth, food, saliva, to flow out to maintain the airway open. Do not put any hard objects into the patient's mouth, chopsticks, spoons, fingers, to prevent tongue bites. Artificial respiration is usually not required for emergency treatment during a seizure, and it usually stops naturally within 5 minutes, mostly 2 to 3 minutes. Accompany the patient until the seizure stops. If the convulsion lasts for more than 5 minutes or the patient has a second or third seizure immediately after a seizure, persistent epileptic seizure state, send to the hospital emergency room for treatment immediately.